Hello, community of practice members. My name is Susan Rogers, and I am a Senior M&E Specialist with SeaChange. I would like to spend some time with you today talking about the challenges we face in trying to conduct outcome evaluations of our communication programs. I would assume that the reason this presentation sparked your interest is because you are already aware that conducting rigorous outcome evaluation of communication programs can certainly present a significant challenge. I try to cover several of these challenges in this presentation, as well as some general overall challenges that we confront in M&E. I hope this time together will be useful to you, whether your primary work responsibility is M&E or you have other related responsibilities. So let's proceed to the next slide. I hope to accomplish a number of objectives with you today. First, I will provide an example for you of an outcome evaluation that was conducted of a social and behavioral change communication program, or what we call an SBCC program. This will help ground you in the subject matter that we will be talking about. Second, through the review of several different challenges presented to you, I intend to increase your understanding of what evaluators confront when conducting outcome evaluation of communication interventions. Third, and most importantly, I hope to increase your understanding of some ways to try to address these challenges if you confront them in the field. I'd like to point out that there are definitely more challenges to outcome evaluation than are covered in this presentation. What we have tried to do is address ones that we feel are fairly common. So let's move ahead with the meat of this presentation. I felt one way to start talking about outcome evaluation of communication programs would be to present you with an example. The one I have selected is an evaluation that was just completed by SeaChange in Ethiopia and funded by USAID. While data are still being analyzed, it allows us to understand the approach that was used. On our next slide, we talk about the research question addressed. In our SeaChange Ethiopia program, we and our stakeholders were interested in exploring what is the value added of using a social and behavioral communication change, or a SBCC approach, versus not using an SBCC approach in trying to bring about positive health outcomes in our target population. In other words, will our target population be able to achieve better outcomes if an SBCC approach is used versus a non-SBCC approach? So let's move ahead and see how we can set up this evaluation. So what was the SBCC program that we implemented and evaluated? Our SeaChange program in Ethiopia was in the content area of malaria prevention and control. It was theory-based, and it included multiple intervention components that together were trying to bring about several positive behavioral outcomes and related psychosocial determinants. This included outcomes such as increased ITN use and malaria treatment seeking, as well as increased knowledge and perception related to ITN use and malaria treatment. How did we do this? We used a rapid scale-up scheme that integrated social and behavioral communication for change, SBCC, into a health extension program. This was a health program that was being implemented by the Federal Ministry of Health in Ethiopia. Simultaneously, SeaChange strengthened the SBCC capacity of government health workers and shared communication materials with NGOs. As I said, the communication program had multiple components, which included mass media, community mobilization, and interpersonal components. Let's move on to talk about the evaluation of this program. So, if you remember, the main research question we were exploring was about the value added of using an SBCC program approach versus a non-SBCC approach. With this research question, the evaluation calls for a quasi-experimental design to allow for comparison, one where the study would be done in both intervention and non-intervention communities. Our intervention communities were ones that were receiving the C-Change SBCC program I just described to you, and the program outcomes of these communities were being compared to the same outcomes in non-intervention communities. These non-intervention communities were receiving the existing government-funded program without an SBCC component and were therefore the comparison group. Let's move ahead and discuss the data collection methods we used in this study. The study used both quantitative and qualitative data collection methods. We had a household survey that was conducted with a target population that was largely quantitative, including measures related to the behavioral outcome variables and the determinants that were explored in the study. In addition, we conducted focus group discussions and in-depth interviews with both the target population and program implementers. This allowed us to explore in more detail the behavioral outcomes, including facilitators and barriers to achieving these outcomes. Let's next talk about how we are going to be analyzing these collected data. We will initially conduct univariate analysis, such as t-test with continuous variables, and then chi-square with dichotomous variables. We will do this to show how study participants in intervention versus comparison sites compare on our key outcomes of interest. Next, we will conduct multiple and logistic regression, controlling for demographic confounders. Here we will examine the relationship between both participants' level of exposure to the intervention and whether they participated in the SBCC intervention or not, and the key outcomes of interest. If you are not familiar with regression analysis, it is a statistical procedure conducted with evaluation data to understand the relationship between independent or predictor variables and our main dependent variables. In our analysis, this would mean seeing if there was significant relationship between participants' level of exposure to the intervention, or whether they were exposed to the mass media, the community mobilization, and or the interpersonal components, one of our predictor variables, and our behavioral variables. It would also be seeing if there was a significant relationship between whether they participated in SBCCs or not, another one of our predictor variables, and our behavioral outcomes. Generally, we would be running these analyses to test some of our predictions, which would be the following: that those who had higher versus lower exposure to our SBCC intervention components would show more positive behavioral outcomes, and those who had participated in the SBCC intervention versus the non-SBC intervention would also show more positive behavioral outcomes. So let me say a bit here why we control for confounders in our analysis. Confounders are other factors related to our study population that may actually be accounting for the relationship between our predictor variables and our behavioral outcomes. These confounders can include such factors as gender, age, or other demographic characteristics of the folks in our study. By controlling for them, we can tease out their effects and see if the main relationships we are looking at between predictors and outcomes are still there. Finally, let's look at the last bullet listed on our slide on data analysis. It is important to note that our quantitative data analysis will not stand alone in producing evaluation findings. We will analyze our qualitative data from the focus group discussions and the in-depth interviews, along with our quantitative data, to help inform program improvement. We refer to this process of using and analyzing multiple sources of data as triangulation to help validate our findings. So, enough said about how we will be analyzing our Ethiopian data. Let's move on to talk about challenges in conducting outcome evaluation of communication program, which is really the guts of our presentation. We will take on two topics in the balance of this presentation. We will present various challenges that evaluators face in conducting outcome evaluation of communication programs. Then for each challenge, we will discuss suggested ways to address the challenge. So let's get to it in the next slide. Challenge 1. If we are going to contribute significant time and resources to conducting outcome evaluation, it is important to use as rigorous a study design as possible. Without a rigorous design, the validity of our study findings will be questionable, both to our funders and the larger field of evaluation. So, in order to build rigor into your evaluation, you need to use some sort of comparison or control group. The most rigorous design to use is randomized controlled trials, referred to as RCT, where individuals in the study are randomly assigned to either receiving or not receiving the intervention. Let's look at the specific challenges around this when evaluating communication interventions. First, using a randomized controlled trial design is pretty unrealistic in evaluating most communication interventions. This is especially the case when mass media interventions are conducted. You cannot randomly assign persons in a community regarding who will hear the prevention messages versus those who will not. Second, it may be difficult to find a group that is comparable and closely matched to our study group that will be getting our communication intervention. Third, conducting data collection in two groups, intervention and comparison, can be costly. Fourth, we may face issues of ethics if our comparison group does not get the intervention we will be giving to our study group. And finally, which is especially true for mass media interventions, our intervention often has a wide reach so that a potential comparison group will often be exposed along with the study group. This is the same thing that we confronted in terms of trying to use an RCT design. How can we address these challenges? Let's move on to the next slide and see how. Here's a couple of suggestions to address this challenge. You can try to identify a community near enough to the SBCC program to make data collection cost-effective, but beyond the reach of the communication interventions and personal connections to your comparison group. So we know you cannot use an RCT design where individuals in study location are randomly assigned to either getting or not getting the communication intervention. However, there is an alternative to this. What you can do is identify a number of communities that have similar demographics and randomly assign them to either where the communication intervention will take place or where it will not, which will make up your comparison sites or communities. Let's take on handling another challenge in our next slide. Another feature that is used to make a study more rigorous is collection of pre-intervention or baseline data, as well as the collection of post-intervention or end-line data. This design feature was challenging in our Ethiopia study. Here the program used a rapid scale-up scheme, and it was not possible to know at the beginning of the program what the total number of communities would be that would receive the SBCC intervention. While baseline data were gathered from a small number of communities in the beginning of the program, and this was helpful to inform program design, data could not be collected at baseline from all communities that would eventually receive the intervention. If we used a pre-post test design for our study, we would have only been able to examine the effectiveness of the C-Change program in a subset of the intervention communities. While the Ethiopia Study Analysis Plan is still being finalized, let's move on to talk about one hypothetical way to address this challenge in our next slide. In this circumstance, it would probably be best to use a post-only design. In the Ethiopian program, some communities that took part in the SBCC program early on received the full 180 days of the SBCC intervention plus an extended maintenance. By extended maintenance, we mean that the program staff provided some level of refresher activities to help maintain a sustained effect of the program. Communities that received the intervention later in the 3-year program generally received only the 180 days, but without maintenance. What data analysis could do here is control for the length of time that participants were potentially exposed to the intervention, or whether or not they got the full 180 days and maintenance, or just the 180 days. The study would then predict that those in communities that received both the 180 days of intervention plus maintenance would achieve better behavioral outcomes than those who received the 180 days only. This nested comparison of length of intervention received allows for another predictor variable. Let's move on to discuss the third challenge in conducting outcome evaluation. Our third challenge is trying to separate evaluated project effects from those of other projects. This is a common challenge that many of us face. Our communication program is operating in the same location as other health programs, and it is difficult to separate the effects of our program from others in the same location. How can we claim the positive effects that are shown in our target population are due to our program and not the rest of the noise? Let's think about some possible solutions and move on to the next slide. One method that can be really helpful in this situation is statistical in nature. It's called propensity score matching, or PSM. This statistical procedure or method allows you to use your collected data to predict what would have happened without the intervention and confidently attribute change found in the study group to the intervention. Let's say a little bit more about PSM in the next slide. The way PSM works is that through analysis of your data on the computer using relevant software, it predicts the probability of whether the study group was exposed or not exposed based on several observed predictors in your database. This sets up a treatment and control group. This is done by running the statistical procedure for logistic regression, which creates a counterfactual group or a control group for your analysis. This, in turn, reduces the effect of confounders, or what statisticians call covariates. As discussed before, confounders or covariates are those other factors that may influence whether a person's behaviors are impacted by the intervention being evaluated, factors over and above those main predictor variables that you are expected with change behaviors. That's about all I'm going to say on propensity score matching. I encourage your use of this statistical procedure for your evaluation. I have listed some resources on the slide regarding how it was used in evaluating the Tasha radio series in South Africa, as well as more of a tutorial on the procedure. Let's move on to the next challenge. Fourth challenge is when you know that you are going to need to collect data at several points over time, not only at baseline and post, but at several times after a communication program has been launched. This can often be the case if you are evaluating a mass media intervention where new ads or messages are released over time in a delayed manner. In this circumstance, you may be challenged with how to effectively time when data is collected in relation to the releases of ads or messages. In addition, conducting longitudinal cohort studies where you have to follow the same exposed individuals over time can be challenging. Certain persons are hard to find again, and there may be a loss to follow-up. Let's see how we might address these challenges. Rather than conducting longitudinal cohort studies when loss to follow-up is an issue with your study participants, panel cross-sectional studies may be more advantageous for you. In such studies, a cross-sectional design can be used in which data are gathered over time from the same population, but not the same individuals. Let's move on to address the challenge of the timing of data collection. There are several things you should consider in addressing the challenges of the timing of data collection. First, make sure to consider the length of time your intervention will need to be conducted in order to get the desired change you hope for in your target population. This sounds like a no-brainer, but you'd be surprised how many folks don't allow for enough time of exposure. Some people recommend doing an initial pilot of the intervention and evaluation in order to get a realistic idea of critical exposure time. Not a bad idea if you can afford it. If you're evaluating a mass media program and have new messages or PSAs that are being released over time, this will also need to be considered in the timing of your evaluation. Along with the baseline before any exposure takes place, you will need to obtain a measure directly after each period of possible exposure to the new message or PSA. And, as the last bullet on the slide suggests, if resources allow, you may also want to obtain a measure several months after the intervention to determine if there has been a sustained impact. Let's go on to our last challenge. This last challenge related to outcome evaluation of communication program is also quite common. The reason is that it's so common is that communication programs often involve several components, and funders and other stakeholders are interested in understanding how the different components contribute to achieve outcomes. They may ask the question, so what about the program is really accounting for the positive change? Let's see how you might go about addressing that question and challenge in your outcome evaluation on the next slide. The most important thing to know is that in multi-component program, exposure is not an either-or measure in your evaluation. You really need to include a measure of exposure for each component in your overall exposure measure. In your analysis of data, you will need to measure the dosage effect of being exposed to the various components, as well as each alone in understanding the effects of exposure in bringing about positive population outcomes. And, as said in the previous slide, when evaluating the effect of mass media component in a multi-component program, you will need to control for who is exposed. To determine this, you will probably need to use statistical methods with your data, such as PSM. The next slide shows you a graph from an evaluation conducted in Zambia regarding the different levels of exposure based on component. Let's go there. Here are the various levels of exposure to different intervention components are shown. You would probably predict that the overall change in malaria behavioral outcomes over time would be largely due to exposure to health provider information. However, the outcome evaluation will be able to use data on exposure by component to help explain the predictive capacity of the different components. Let's go on to the final set of challenges. So far, we have discussed some of the challenges you may have faced or will face conducting outcome evaluation of communication programs. I didn't want to end this presentation without acknowledging that there are some generic challenges in the field of M&E. In my 20 years of M&E work, there are issues that keep coming up. I don't have time to take them all on, but I will spend the remainder of our time together talking about two of these. Let's proceed. I love working with dedicated program implementers. They are the lifeblood of our public health work. What I have found is that most are so driven in the doing of their important work that they often do not take the time to use M&E data once it's collected. Half the time, these data sit on the shelf. I found this is not generally due to not respecting the M&E work that has been done. I found it has more to do with program staff not knowing how to utilize the various pieces of data to inform improvement of their programs. So let's discuss ways to prevent this situation in the next slide. It's been my experience that the single most important tool to allow meaningful use of M&E data is having a theoretical framework for your program. This is often referred to as a program logic model, but different terms have been used. Many of you may already be familiar with what I'm talking about. This is a framework schematic that displays program inputs, or the resources that are used to design and implement the program. It also includes activities that the program plans to implement. It also includes program outputs, or the products of what is expected from implementing the activities. Finally, the framework includes outcomes or changes in the target population and communities that the program is expected to achieve. This important tool informs the program of the targets and benchmarks that need to be evaluated over time related to program outputs and outcomes. Once monitoring data are available related to outputs and outcomes, they need to be compared to your targets and benchmarks to determine what progress is being made or not made. When this is done on a regular basis, the framework should be revisited and adjustments made as needed. The next slide describes a logical framework for a youth program and how M&E fits in and data can be used. So on this slide, we have a simple logic model for a youth prevention media campaign. It outlines relevant inputs, which is shown on your top box, your activities, the second one down, the outputs, as well as short-term, intermediate, and then your long-term outcomes. This framework guides the program on what needs to be monitored to determine if the program is being implemented as planned and whether outcomes are being achieved. Once M&E data are obtained, program staff need to review targets and return to the framework to determine how the program can be improved or adjusted. Let's move on to discuss the final M&E challenge. The last challenge I will present to you is one I know you all have experienced or heard about. Generally, programs are challenged with having sufficient resources to conduct M&E. This often falls into two categories. First, program staff are often not trained to acquire M&E skills. While they may have a superficial understanding of M&E, many programs do not have in-house capacity in evaluation design, in data collection methods, data analysis, and/or reporting. Secondly, programs are often strapped for funds that are prioritized for program implementation. A little is left over for M&E. However, funders are now putting a higher priority on M&E. Here's a few suggestions in the next slide for how to address this challenge. First, you may want to consider hiring a local consultant to assist with M&E, especially concerning more technical pieces such as evaluation design and data analysis. I have often found that local education institutions have graduate students who have become skilled in these areas. They are often anxious to either work for free or as a low-paid intern. It is worth consulting your donor for agencies or institutions or specific evaluators they may know of who can help. Also, your program should make it a priority to take part in M&E training sponsored by donors so that you can build staff capacity in this area. Finally, you should consider committing at least 10% of your budget to M&E. If this is not possible, try asking your funder directly to carry out an external evaluation of your program. You may also think about connecting with other sister organizations in the same area to pool your resources so that more is available to address M&E. I'll close this presentation out with the last slide. I want to say it's been a pleasure spending some time with you today. While it's not been a lot of time and we were only able to cover a small number of challenges, I hope it's been useful to you. Just remember, with overcoming challenges comes pearls of wisdom that can be used in years to come to benefit your M&E work and the programs you serve. So, I wish you the best of luck with evaluating your communication programs.